After creating and sending out a survey about who should and shouldn't be prioritised on the organ transplant list out of people with named mental health disorders, the old, the young and the pregnant, the results showed that in response to who should be prioritised least, 16.7% said people with drug addictions and another 16.7% said people with suicidal tendencies.
A 61-year-old woman was denied a kidney transplant because there was an excessive amount of alcohol in her urine, giving the impression to doctors that she had an alcohol addiction. In reality, she did not have an alcohol addiction but had a condition where her bladder fermented sugars into alcohol. However, if she died of this lack of care, that would be another life lost due to the discrimination that people with addiction face on the organ transplant list.
Not only are people with addictions at risk of this unconscious bias, but those with other mental health conditions such as suicidal tendencies and eating disorders. Therefore, we will explore why these groups may experience discrimination and whether the reasons for this are justified.
Eating disorders. Unbeknown to many, eating disorders have the highest mortality rate of any mental health condition, often due to the physical strain that they put on the body. As a result, sufferers of eating disorders may require transplants for the organs damaged during their illness.
Anorexia nervosa is where the sufferer feels a compulsive need to keep their weight as low as possible while restricting their food intake, which is sometimes accompanied by exercise addictions and other restrictive habits. This can put immense strain on vital organs, causing conditions such as arrhythmia, low blood pressure and fainting.
Bulimia is characterized by episodes of uncontrollable binge eating, followed by purging, whether in the form of excessive exercise, induced sickness or laxative abuse. The physical repercussions of this illness range from tooth damage and acid reflux to the bursting of blood vessels and heart failure, sometimes resulting in the need for transplants.
On the one hand, some may blame those with eating disorders for their physical health problems because they are self-induced. However, if this were the reason for denying someone a transplant, the same could be said for many of those on transplant lists because of poor diet and lifestyle choices. An alternative is to persuade them to choose recovery, as this would mean that they are less likely to abuse their body and the organ given to them in the future.
Alcoholism, the addiction to the consumption of alcohol, can derive from a range of issues, and as well as being mentally problematic, also results in physical consequences. These include heart disease, cancers in numerous organs, cirrhosis, and more.
Drugs. Drugs are often something people turn to when they are struggling and need something to give them temporary pleasure. This makes them easily addictive and damaging, as once in a bad place, the feeling that drugs give them can become something that they rely on. Not only are they highly addictive, but they can have irreversible effects physically, such as heart attacks, strokes, and breathing problems.
Smoking and vaping, which is becoming more common with the youth, is an extremely dangerous addiction, which often damages the heart and lungs with the harmful substances and chemicals inside, sometimes leading to cancer around the body.
As we have outlined, addiction can have a serious effect on the physical health of the sufferers, which oftentimes leads to organ transplants, although some would argue that these people are just as deserving of organs and this should not be a factor of where they fall on the list, as there could be many reasons why someone has ended up where they are and possibly by no fault of their own. Others would argue that these conditions are self-inflicted and healthy organs should go to those who have lived healthy lives.
People with these addictions are often discriminated against because doctors feel that they cannot be trusted to treat their new organ well. Therefore, many are left to die from their illnesses without being given a second chance at survival.
Suicidal tendencies. Suicidal tendencies make people question whether they deserve to live and often weigh down on one's mental well-being, which in turn can affect their physical health. Also, after a transplant, if someone acts on suicidal thoughts, some may argue that it wastes an organ that could have been given to someone else. Therefore, doctors must decide whether to give someone with those tendencies an organ in spite of the risk that they might abuse it.
Hippocrates said that it's far more important to know what person the disease has than what disease the person has. Therefore, it's a right to hold an unconscious bias towards a mental health condition, neglecting the human behind the illness.